Yesterday, Wuhan reported no new cases for the first time since the outbreak started. Wuhan provides hope for the rest of the world. Today, I have a message for young people. You're not invincible. This virus could put you in hospital for weeks or even kill you. Even if you don't get sick, the choices you make about where you go could be the difference between life and death for someone else. I'm grateful that so many young people are spreading the word and not the virus.
Take one look at what's happening in some health systems around the world. Look at the intensive care units, completely overwhelmed, the doctors and nurses utterly exhausted. This is not normal. This isn't just a bad flu season. These are health systems that are collapsing under the pressure of too many cases. This is not normal. This is not just a little bit worse than we're used to. This is tough for systems.
There could be significant sickness and loss of life.
The greatest tragedy for me, among all the tragedies we're seeing in this outbreak, is the prospect of losing part of our health workforce. That those individuals, those doctors and nurses and hygienists and others who put themselves in the front line to care for our most vulnerable would themselves become exposed, become sick and potentially die because they don't have protective equipment.
We're currently finalizing
You really have to get back to the hardcore public health measures of case finding, contact tracing, quarantine, isolation. So in some senses, we need to slow down the virus, then we need to suppress the virus, and then we need to go after the virus. And that takes different combinations of different measures. But social or physical distancing measures and movement restriction measures are very hard socially and they're very hard economically. WHO has distributed 1.5 million lab tests around the world. If we look forward in this epidemic and we project ourselves forward a number of months and the amount of testing that's going to be needed, we need to scale that up approximately 80 to 100 times. So it's not about doubling the availability of lab tests, it's not about trebling it, it's about potentially increasing that 80-fold. Now that's an extreme analysis, but that's what we need to aim for.
We have said from the beginning that our greatest concern is the impact this virus could have if it gains a foothold in countries with weaker health systems or with vulnerable populations. That concern has now become very real and urgent. COVID-19 is taking so much from us, but it's also giving us something special, the opportunity to come together as one humanity, to work together, to learn together, to grow together.